I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr.
Good morning.
Lebowitz.
Good morning, Dr. Lipo, Gyno, and beyond. Today we got this 31-year-old gentleman from the Bronx, New York. I grew up in the Bronx a little bit. From the Bronx, he comes with Gyncomastia surgery. You know, it's funny. He looks a little like Drake, and we were having a discussion about Drake, but I'm not gonna mention anything more. But he looks a little like Drake. But he's got Gyncomastia. Now he weighs about 215, somewhere between 215, 220. And he, was down to 185, but he still had man boobs. He needs to lose weight. I want him to get back to 185 again. We're gonna clear this all up. He's gonna look great, but needs to lose some weight. I think that would be perfect. We're doing Vaser, high definition power assisted liposculpture, Gyncomastia gland removal, and Renuvion J plasma for skin tightening. He does not want fat grafting. He does not want fat grafting at all. He's saying, why put the grasa back when you're taking it out? Which I understand. You're living with this for such a long time. He's saying, why put it back in? So because of that, we're not putting the fat grafting. I'm going to add the belly button incision. So I'm going to do the mid, upper belly, and the chest. He's got this old incision, like a double belly button. I think you had a umbilical hernia, right? He had a hernia done. Usually when you do the hernia, the incisions, where I give it, but they put it here for some reason. But he's got like a little thing, so I'm gonna make an incision inside the belly button, and I'm gonna break this little thing and really, sculpt him down. As far as a six-pack abdomen, no, I think I'm gonna shy away from that because you'll look like a Ninja Turtle right now. Do you agree?
Yes.
Yeah. So I want to just make him plano, right? Make him plano. We're going to change his name to Flacco. Make him skinny. So we're going to go down to and a little bit below the belly button, to the sides, to the lats, up here, etch and define the lats, the pecs, the serratus muscle, the six-pack abdomen. As I said, I'm going to be very gentle with that. Maybe I'll give him a little bit of horizontal, but I'm going to give him the midline linea alba, the semilunaris, and go all the way around to his back, even through my stealth incisions. Get to about here, and get to about here to really kind of make him beautiful and lean. Stealth incision in the armpit, by the nipple, as I said, inside the belly button on there. Remove the glands, remove the glands, and do Renuvion J plasma to help tighten all this loose skin up. All done under local anesthesia. Lipo, Gyno, and beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. So what I'm doing when I'm vasering, I'm doing this exactly where I want to contour the muscles. Contouring the fat, of course, but I'm also concentrating on the muscles. Because we're not doing fat grafting, but I do want to give him some definition of the muscles. That's what he deserves. Not just making him plano. I'm gonna...
I'm be looking like The Rock.
Make him look like The Rock.
Yeah.
Or at least Vin Diesel.
Vin Diesel? I don't know about Vin Diesel. I like The Rock more.
You like The Rock more?
Yeah.
Alright guys, so I'm on the left side here in my stealth incision in the armpit, and I'm getting to the side boob. It's very important to do this anatomically. So I'm going parallel right now to the lats, which is back there. Get this negative space between the lats and the pecs, and then parallel to the pecs, all the way to the metaneris here. And really, you know, I use the titanium Vaser probe, the long one. They come in 2 sizes. I use the long one. I can get down to the abdomen. I promise him the mid abdomen and up, belly button, around the belly button and up, because we have to contour and shape everything. With me, it's all about going beyond and giving results. Renuvion Titan, he does not want any fat grafting. Get in there, deep in there, all that fat you can see flowing out of there. Get to the lats here. Too much fat by the lats as well. So etch those lats and contour and sculpt those lats as well. In a minute we're going to go to the mid back from the side. Central abdomen now on the left side. Do it again on the other side. Gonna just nipple a little bit more. You need to get all that fat and that grasa, that gland all melted. Midline belly button a little bit. And then we'll start the lipo. This is just the Vaser. This is just melting everything. Getting it all ready for the liposuction sculpting. Lipo, Gyno, and beyond. So this is the Liposuctionator 5000. It sucks out fat 5 liters per second. It makes an elephant into a dachshund, but not just any dachshund, a dachshund that doesn't forget. Alright, so got out 1.25 liters from this side only and whittled these glands down to perfection. So remove these these babies, these mamas, these poppies. It's time to do that. There you go. Say hello to my little friend. Is that how it says?
Yeah.
You probably say it better. Say it better, Garcia. Say hello.
To my little friend.
What?
Say hello to my little friend. Goodbye. Kanahara.
Goodbye. Say hello, my little friend. Alright, so just checking. So, if you see little stuff right here, let me see what's going on right here. That's garbage. Alright, so if you guys can see, let me just a little bit right over here. Good. Good. Yeah, but look at the chest alone. I'm not done yet, but gone, flat, and that's all still there. Okay? Good. All right.
Right by you. By the way, it's right by you.
Dr. Lipo Gyno and Beyond, 31-year-old from the Bronx, New York. We did everything. We did Vaser, high definition power assisted liposculpture, Gyncomastia gland removal, and Renuvion J plasma to tighten everything up. We went down to and a little bit below his belly button. He did not want any lipo filling. We got out about 3 liters of purified fat from him, where we etched, defined, and revealed all the muscles involved, which includes the lats, the pecs, the serratus muscle, the abdomen. We didn't give him a true 6-pack abdomen because it would look fake on him, and he didn't want it. He wanted to be flat. He wanted to be plano. He wanted all that grassa out. But we did give him a little bit, 2, 4, and 6. Stealth incision in the armpit, by the nipple, and inside the belly button. And went to the sides and the back and down to and a little bit below the belly button. Because of the large amount of fat that we got out of them. And the glands that we removed, they weren't that big, but a lot of fat was in there. We got pseudo-gynecomastia, a lot of grassa. I elected to put drains in, which is, drains are our friends. These are the glands that are removed. We always have to remove the glandular tissue. All self-absorbing stitches except for the black nylon that secures the drains. And the drains will stay in about a week. All that said, he will look amazing. He'll eat clean, lose weight, get under 200 pounds, and he'll feel fantastic. So if you have gynecomastia, you call me Dr. Lipo Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.